Hello, everyone. Andrew Salciunas here with 97.5 The Fanatic, and it's another great time for me. These are always a pleasure. I get to speak to some of the greatest people in the Philadelphia area, and today I'm joined by Aziz Sadiq, DO. He's a general surgeon. So let me just start off right away by saying thank you, Doc, for what you do. That is incredible. God's work, what you all do, especially at Virtual Health. Everybody there is fantastic. And I've had the privilege to learn about all kinds of different things doing these every couple of months. And so today we get to talk about hernias, which what a great time, because a buddy of mine is actually dealing with it right now. I had to go over to his house and help him out, do some stuff around the house because they're painful, as you know. So let's just start off the simple question, Doc. What is a hernia?
Typically, by definition, a hernia is anything that is a weakness in the body and something can kind of push through it. So we know a lot of hernias from the groin area, but you hear a lot of people talking about bulging discs or disc hernias. That's in the back. So even though there's no muscle in the back that is weak there, that's a different kind of beast. But what I deal with are the hernias related to a weakness to your abdominal wall or weakness in your groin area. And there's something that's kind of bulging through a weakness in the muscle itself. Go ahead.
What causes it? Does it matter what age you are, what kind of body type you have? What causes a hernia?
The hernias that everyone is really familiar with are the groin hernias. Usually those are congenital that you're kind of born with, but you don't notice until later on in life. A lot of young men who are doing heavy lifting or they're very active, they may notice it when there's an increase in pressure from doing activities, lifting heavy things, coughing. We also see hernias in the groin in the older population when they're straining, having a bowel movement. Also, their muscles are a little bit weaker, so they can notice hernias at that time. But hernias at your belly button as well, or hernias from previous surgeries, they can also be related to heavy lifting, coughing a lot, especially with COVID. We had a lot of patients who recently were infected with COVID and had these huge coughing spells and had a hernia prior to the COVID pandemic, but didn't notice it until they actually had the virus and were coughing a lot.
See, I didn't know that. That's fascinating. I had no idea that you could just have one without knowing it. I knew the way that you just talked about lifting something heavy and it causes that. Yeah. So are there ways to prevent having a hernia? Can you know beforehand and then take preventable measures so you don't have it?
Well, if they're congenital, if you're born with the hernia, then the only way you'll know about it is just kind of when you're doing these activities. But there are other hernias that are not congenital. And especially after previous surgery, if you had a big surgery where you have a big scar, you're prone to getting a hernia that way. Patients who are more likely to get hernias after a big incision are those who are diabetics, those who are morbidly obese, smokers, and those who have COPD. So there are certain things in our life that we can control, and there are certain things that we cannot control. Certainly having a healthy lifestyle where you're not smoking or you're controlling what you eat by having and not becoming a diabetic, those things will certainly help prevent you from getting or being more prone to getting a hernia.
Now, how do you know, other than just feeling pain and discomfort, how do you know that you do have a hernia? Are there any sort of early signs that you might see?
So when it comes to a patient realizing they have a hernia, usually they'll notice a lump. And if they don't notice a lump, they'll usually have pain, typically in the groin region or where there's a previous incision or at your belly button. When you have pain at that area, usually you seek the attention of a medical doctor. They'll do a physical exam, and a lot of times you can appreciate hernias on physical exam. Even then, sometimes they can't be identified, and a doctor may order certain imaging studies like an ultrasound or CAT scan or even an MRI, and they can help identify a hernia as well. But typically for a patient, it's the bulge and it's the pain and discomfort that is kind of a red herring for a hernia.
Now, if you think you have a hernia, what should you do? And I'll just say it, I admit it to everybody that I speak to. I'm one of the people that puts off going to get something checked out. And I know that's not smart. So if you're watching this, if you think something's going on, get checked out. So if you think you have a hernia, what should you do?
So part of the doctor's job is to determine which hernias need to get fixed right away or which ones require medical attention a little bit more quickly than others. If you suspect you have a hernia, the first thing to do is kind of figure out if it's kind of uncomfortable or not, or does it go away when you lay down flat? The hernias that usually go away when when you push on them or when you lay down flat, those are the ones are not likely to be causing an emergency, but they do deserve medical attention to kind of confirm that it is a hernia, and if there is anything that you need to do to get that fixed or whether you don't need to get it fixed. But if you do have a hernia that is acutely painful, that does not go away, that stays hard and does not, flatten out when you lay down flat, that's something that you probably need to call your primary care doctor sooner than later, or even go to an urgent care or an emergency room to kind of make sure that there isn't anything serious stuck in that hernia.
Now, Doc, if it is discovered that you do have a hernia, what happens? What are the steps when you go into the hospital? What's the procedure like, recovery time, and the procedure itself? I mean, you do robotic assisted surgical techniques at Virtue, and that's really cool. So what is it like?
So hernia surgery has come a long way, and traditionally hernia surgeries were a lot more painful. They required staying in the hospital for multiple days. But what we have done here, and especially at Virtua, where the minimally invasive surgery is really at the forefront using robotics, we're able to fix hernias typically on a same day surgery basis, where you come in the morning, you get your surgery, you're home before lunchtime. And we're using these small cameras and small incisions to fix these hernias. And with this small camera, it's a high definition camera with it's 3D, and we have these tiny instruments that really mimic what I would do with my own hands or my own fingers, but with these really tiny incisions. I can suture, I can close the tissue, I can place mesh if need be. And that really has improved patient outcome. It has minimized postoperative pain and has really minimized postoperative complications as well. So we're able to really do a lot of the advanced techniques in hernias with minimal pain and faster recovery.
Doc, you're awesome. You've been fantastic. And, just to give you some more credit again, thank you for everything that you do. You're not only a general surgeon with Virtue Health, which a lot of people just think, all right, you do surgery, but you've done minimally invasive surgery, you do robotic assisted surgical stuff. So that's so cool that you do all that. You're a bright man. You're a great doctor. So thank you, Dr. Sadiq. I appreciate it. And if you enjoyed watching this and you want to learn more, we've had a lot of great interviews with a lot of great people from Virtue Health. You can check out more information, especially about hernias, at virtua.org. Thanks, Doc.
Thank you for having me.